Hello, everyone. My name is Jonathan. I'm from Taiwan. It's a great honor to get invited to participate in this webinar to share my experiences by utilizing Tixel and some growth factors in treating hair loss. I'm currently working in Taiwan Adventist Hospital. My specialty is dermatology. I would like to divide my topic, today's talks into 3 different sessions. One is the basic thermomechanical ablation technology. I will briefly go through this. And the next, I will be emphasizing on this Tixel assisted drug delivery. Then the last, I will be clinical experience sharing my utilizing this technology in hair loss treatment. So the thermomechanical system, I think everyone already know it quite well. Of this technology, I'll just briefly go through it. This Tixel basically can divide into 2 different modes: ablative mode, for which it create deep or shallow microchannels of controlled damage to the skin that can stimulate collagen production and aid in rejuvenation. The next will be the non-ablative mode, for which that I'll be utilizing today, will be the heat within the upper dermis of the skin while it's protecting the outer layer, and for which create permeable open channels that can assist the later topical serum and agent into the skin. So we know that this TMFI is a part of the energy-based device. However, it's different from other radiant technologies, such as the laser or other radio frequency modality, for which one form of energy is converted to another form of the energy. This energy-based device that delivers heat to the tissue by direct conduction with no radiant involved. So this direct heat transfer by conduction, it's by utilizing this titanium alloyed shell. This is about 1 centimeter area. This is the only one, the only tip we have in Taiwan that can be used right now. This is a gold-plated copper base, for which a small electric ceramic heater that can deliver, maintain 400 degrees Celsius this heat during the treatment. And as the tip rests on the skin, the tip apexes protrude briefly to create a thermal matching and retract. And this protrusion is part of the parameter that can be adjusted for a different kind of a treatment modality. So the tip design is biocompatible at high temperature. It's no corrosion, easy to clean, and durable at high temperature. And then it's validated in accordance to the ISO. And we don't need to change the tip. No, there's no tip replacement, for which is very good as a money-saving device for utilizing in the clinical practice. The direct heat transfer without secondary effects. There's 2 parameters that affects the Tixel thermal process. One would be the pulse duration of the tip. The other one would be the thermal resistance between the tip and the skin. So the hemispherical heat wave that it created, the temperature at the surface is about 400 degrees Celsius when it touches the skin, right? But it decreases to 50 degrees Celsius at about 100 micrometer, for which it deliver a uniform heat conductivity. The energy is in uniform base. The tip does not mechanically puncture the tissue, so there will be no visible bleeding, but instead it pushes the skin and then deliver the heat as the energy. And the tip briefly contacting with the tissue and then pulls back. So the thermal energy is transferred to the skin, creating this microballs by evaporating of the water without the tissue carbonization. So by changing different parameters, for example, the duration that it contact with the skin or the protrusion that goes pushing into the skin, we can have different kind of energy delivered in different setting. So all we're saying is this is a uniform discrete effect. As a fractional effect, no carbonization, no bleeding. So it's not related to humidity or related to any chromophore. So it doesn't choose the color compared to the laser modalities. So we can changing it to ablative or non-ablative thermal effect. For example, this is showing some histopathological pictures of the Tixel treatment at different settings. A, D tip, for which is the ablative mode. And then we can set it into the 40 millisecond double pulse. B, with the 9 millisecond double pulse. C, 9 millisecond single pulse. We can see how the ablative effect created by this tip energy. And then the non-ablative mode, for which there was no severe coagulation or severe tissue damage. Instead, you're creating some channels for later, we can have the drug delivery. During the healing process, for this setting, we have the 800 micrometer with 60 milliseconds. So in day one, right after the treatment, and then day one, and day 0, day 1, and day 8, we see the epidermis completely regenerate after 1 day with very minor crust remaining. And this is a very important slide, which showing that the TMF5 transdermal effect that perforates the striatum corneum by combining drying and stretching of the tissue, that leading to the formation of the small cracks in the tissues. And then the temperature under the tip is high. So some of the tissue that may coagulate while other segments are dehydrated, for which create a concentration gradient. And then that can kind of initiate the material to flow inward to the tissue. And this is how the drug delivery goes. So the open channel, the tip dehydrates and fractures the striatum corneum upon the contact with the minimum underlying coagulation. And the result is long-lasting, the open channel, and can exhibit absorption for the later topical applied aqueous solution. And then by changing the pulse duration in milliseconds, let's say 6 millisecond, 8 until 18. So short, medium, and long, we can giving different amount of the energy that can be transferred into the tissue. Let's compare to some other technologies. Why we not, what's the better, the pro and con compared to, let's say, laser or other RF modalities? For example, the thermomechanical ablation, it creates no pain and shorter downtime compared to the traditional laser treatment. Because of the ultra micro exfoliation, there's no burning, no bleeding, and very fast recovery, less intolerable pain, and so no anesthesia required. Compared to the traditional laser, for example, it provides exfoliative fractional laser and may burn the skin cells, cell damage, that slow recovery, and then the anesthesia is required. And then let's compare to Tixel compared to the fractional RF and other laser. So comparatively to the sharp pin RF and brown pin RF and to the CO2 laser, the ratio of the amount it provides, the Tixel applies much less energy to the skin compared to other modality for every single, let's say, pin or pyramid that deliver the energies. This is showing the bar graph showing that Tixel applies much less energy to the skin compared to other modality, so that it provides less skin damage, so better healing, but also the prolonged open channel can help later on the drug delivery to be patent, to get more effective. This is the temperature profile in the skin. This is the chart representing the temperature as a function of the depth. For example, let's look at the gray one, the 10 micron, the micrometer. The maximum calculated temperature at the pulse of the 6 millisecond would be around 300 degrees Celsius. And then for the 30 micrometer, the maximum temperature is about 125 at 6 milliseconds. So the temperature on the surface, when it touches the skin, is about 400, and it drops to 50 at a depth about 100 micrometer, for which is constant. Let's compare the energy delivered volumetrically, the active area, and compared to the Tixel compared to the sharp pin RF. So the Tixel, the thermal effect is relatively wider with larger volume than the micro needle RF. We see here, with the average depth and average width higher compared to the sharp pin RF. So volume-wise and efficacy-wise, it's more beneficial. So more efficient in energy transfer compared to the RF technology. As for the wound healing process, after this thermomechanical skin ablation, the wound healing after this ablation is much faster compared to other fractionated ablation methods. We can see from day 1 to day 14. So the treatment interval of 2 to 4 weeks could be recommended. And this is how I set up my patient to have the hair, later on I will be explaining, to have the hair treatment in every 2 weeks. So as for the wound healing, this TMA Tixel revolutionized the field of fractionated device, especially in the darker skin types. The wound healing procedure occurring after TMA skin ablation, it resembles already known as the CO2 laser or the bipolar ablative ratio frequencies. However, in this TMA, we observe a complete honeycomb pattern. That means the fixation of the after the treatment already after the 14 days, the healing process. In the case of the CO2, 100%, 89.5% skin damage, even visible after the day 21 after the ablations. So compared to the RF, after 14 days of the treatment, the subepidermal damage could also be seen in all the treated patients. So as to conclude that TMA was well tolerated by the patient and only minor skin symptoms were observed. And then, so the session shorter than 4 weeks could be clinically recommended, but not as recommended, not as further, not to reduce less than 2 weeks, at least to wait for the pattern to heal. So let's compare these 3 different devices, Tixel, carbon dioxide laser, RF. So the skin type, the Tixel doesn't choose. We can apply in any kind of skin type. The short downtime and the post-treatment pain was very low compared to the CO2 laser was kind of high. That's why the anesthesia is required for the CO2 laser. And then post-treatment pain is minimum. And sterile, it's sterile. We don't have to wait. We don't have to send the tip for extra sterilization. And there's no smoke and no smell. And there's no bleeding. We don't need to wear a goggle for the eye safety. And then the thin skin, it's applicable. And then it's not, we don't have to worry about the disposable tips because it's self-sterilization and it's compact. And then the open channel is very good and it can be very superficial. And then the patent open channel can help out with the later drug delivery. So as the Tixel acting as the role as a model in assisting the drug delivery, we have to look at the anatomy of the human skin. This is the striatum corneum. It's about 15 to 20 micrometer compared to the variable epidermis as 130 to 180 micrometer. It's different from person to person, but it's about this range. And then dermis, it's about 2000 micrometer. Then would be the subcutaneous fat. So what we're saying that is previously we're saying about 100 micrometer, it's about 50 degrees Celsius. And then the skin, the open channel that created was good enough to have the drug delivery instead of creating too much of the tissue damage. There's several routes for the drug penetrations. For example, intracellular routes, follicular routes, or eccrine route, or intercellular route. For this transdermal drug delivery technology, we have the active method. For example, the thermal ablation, we can utilize laser or radio frequency, electrical iontophoresis, electroporation, or by mechanical microneedle, or by the jack injector, or the ultrasound, or the passive method by changing the formulation, for example, the liposome, or by using the chemical enhancer, eutectic systems, or prodrugs. This here is a picture showing the method for the intradermal injection. Or for example, in this hair treatment before, I used to use this PRP, or we use this intradermal injecting of those active agents. Here are some methods described here: the liquid jet injectors, microinjection, microneedles, tattoo device, or this powder particle injection or gold particle injections. But the problem about this intradermal injections is really the doctor depends on the method and depends on how good you are, how you can provide a uniform result by injecting to a different levels, or during the injections, some of the materials might be lost by different methods. So there's some pros and cons about this intradermal injections. So is there any other way? Yes, by using this thermomechanical fractional injuries system. So the open microchannel on the skin is efficient in the transdermal delivery of the aqueous solution. As to stand up, upon the contact, the titanium tip, it dehydrates and fractures the striatum corneums. And then the outermost keratinized layers of the skin with the minimum underlying coagulations. So the outcome would be the efficient absorption of the topical applied aqueous solution. It's more like a sponge effect. The dry tissue, it creates a relatively high water concentration gradient between the liquid-based drugs on the surface and then the skin layer beneath it after applying this Tixel. Up to date, there are many of those published papers indicating that this method, this system can help or enhance in the transdermal deliveries of different kind of active agents. For example, in this publication, it says that after applying this phenol red and then the Tixel treatment with 400 millimeter protrusion and 8 millisecond pulse duration, we can see the changes from the yellow to red when the dye penetrates inside the micropores, indicating an exposure to the physiological changes of the pH. And then here comes with the confocal microscope on the human skin and showing that the striatum corneum, the micropore on this striatum corneum after the Tixel treatment. So the microchannels were stained by the sodium fluorescency applied immediately after the Tixel, which showing the red circle. This is the skin surface, and then the epidermal layer, and then to the papillary dermis layer. This chart showing the Tixel in 2 hours and Tixel in 6 hours. The fluorescence dye representing after 2 hours and 6 hours. So there's no real tissue damage when the Tixel applied and operate in a very short duration, I said less than 9 milliseconds, and a protrusion of 400 micrometers. The diffusion of the hydrophilic dye, such as what we're showing here, the fluorescent sodium, and then confronted the less impedance and due to the increased skin permeability, and then for which the microchannel can remain open for at least 6 hours. Here showing another figure and saying that the permeation, percutaneous permeation of verapamil hydrochloride, and at 6 milliseconds, and then 9 millisecond pulse duration with 400 micrometer protrusion. Compared to the untreated skin, we have more of the drug permeation. And the one on your right, the percutaneous permeation of the sodium diclofenac, and showing that at 8 millisecond pulse duration and 400 micrometer protrusion of untreated and treated. So we have more of the drug permeation in the treated skin. So by changing the contacting time and the pressure, so at 10 milliseconds, this is sublative tissue treatment. The epidermis start to get damaged, but still there. So you can see the dermis starting to get mild coagulated. But if you increase to 12 milliseconds at 800 microns, then epidermis start to obliterate it and then start to get desiccated. And this whole area is coagulated. So it's more equivalent to the CO2 ablative treatment. So by adjusting the contacting time, and then the protruding length. So we can change in the parameters by a different energy given. So that's here comes with my clinical experience in the hair loss treatment. As we know, this Tixel can have different indications: aesthetic treatment in the facial rejuvenation, on neck, on body, and even for dry eyes. So what's more, assisting in hair loss treatment. So in my experiences, mainly I'm focusing on those patients with androgenetic alopecia, male and female. So let's talk about this. The follicle miniaturization is accompanied by the decrease of the anagen, with an increase in percentage of the resting hair follicle containing microscopic hairs in the bald scalp. So at least it has to be at least still some telogen there. So there's the infiltrating of the lymphocytes and mast cells that have been identified around the miniaturized follicles, especially in the area of the stem cell rich bulge areas. In this balding scalp, the number of the hair follicle stem cells remain intact. However, the number of more actively proliferating progenitor cells is decreased. Here's the complication of this hair life cycle, starting from the anagen to the catagen, and catagen to the telogen, telogen, exogen, and goes through this one cycle. There's so many growth factors that play important roles throughout different stages in this hair life cycle. Anagen accounts for 85% of the hair population, then catagen less than 1%, then telogen 14%. Goes through the whole cycle is about 4 years. And each hair follicle cycle should go through this lifespan of about 25 to 27 times. So that means each hair follicle, we can have at least 100 years old, 100 years of lifespan. However, this is not the case because of too many factors. For example, genetic, hormone, the lifestyle, or the food intake, environmental stress, all those factors will decrease the number of the cycles lifespan. So let's say only to 20, that means 80 years, or 15, 60 years, the hairs start to get miniaturized, and then we lost the hair follicle. So is there any way that we can kind of boost the hair to go for one more cycle? That will be one more 4 years, 2 more cycle, 8 years. Here goes with different modalities. The minoxidil, up to date, there's several treatment modalities in treating this androgenetic alopecia. For example, minoxidil, topically, finasteride, dutasteride, or anti-androgen, orally, laser, LED, LED, and then PRP, growth factors. The last would be the hair transplant, hair restoration. As for the first 4 modalities, we're trying to reboost or trying to make the thin hair to thicker hair, or to make the thicker hair stay in the thicker hair longer. It's different from the last one. To make hair restoration means extracting the hair and do the hair implantation. Right now is the era of the regenerative medicine in the aesthetic medicine. So clinically, application would be focused on the repair, replacement, and regeneration of the cell, tissues, or organ to restore the impaired function resulting from any causes that have been mentioned before, including a congenital defect, disease, trauma, or aging. So it can include cell therapy, tissue engineering, gene therapy, biomedical engineer technique, as well as that those involve pharmaceutical, biologics, and devices. Growth factors would be the one I'll be utilizing today. So during any injury, the platelet activates the coagulation and release protein as the tissue in the tissue repair process. The protein contained in the platelet alpha granule are called growth factors. So this is how I utilize the Tixel in the hair loss treatment. The patient reported no pain during the procedure. I've been utilizing this method for about 1 year, and there's no excessive crusting, flaking, bruising, blistering, or bleeding with this treatment. After applying this Tixel for 100 shots, then this is not injecting, this is only spray the growth factor on top of the scalp. Then I do a little bit of massage. And in this 27-year-old female, after this is two treatment, 1 month times 0, and then 1 month here. We see the differences. So this is how the lady I shown before was my nurse. So this is how I started, and it interested me to set up a protocol, a study design with Tixel 400 micrometer and 5 milliseconds. For each session, I give 100 shots, and then immediately applying 2 mL of this AQ Hair Complex Plus, for which is made in US. And then the ingredient as listed over here is contain a bunch of the growth factors, which was proved to help to be beneficial in the hair regeneration. And then every 2 weeks for 3 months, and then that will be 6 sessions. Then I take the digital photograph at the baseline and each treatment sessions, 0, 4 weeks, 8 weeks, and 12 weeks. The treatment protocol would be patients have to have their hair washed before the visit and avoid hair washing in 24 hours after the treatment. And then the improvement assessment was by this investigator global aesthetic improvement scale with 0 of no change, 1 mild improvement, 2 moderate, and 3 significant improvement. Also, I also let subject to kind of feedback on the improvement with the same scale. Here is a 70-year-old male after the treatment at time 0, after 1 treatment and 2 treatment. On the scale, the score I given was about 1, with only mild improvement. The patient himself give a 2. This is another 35-year-old male. The patient himself give a 2, and I give a 2, a moderate improvement. Here comes another patient. I give a 1, and then subjectively, they give a 2. Here goes around the frontal region after 3 months, and then 1, and then the subject give a scale of 2. Here is another 52-year-old male, 0 and 3 months, 1 and 2, similarly. Another female with the thinning of the hair around the central scalp. Another female patient, 48 years old. Sorry, I have to emphasize on those female patients, I also do a blood check prior to their treatment to rule out other possibilities in inducing the hair loss, because we know that in female, some more factors might be more influential. For example, the thyroid function or autoimmune disease or lacking of the ferritin, lacking of the vitamin D, etc. And so I also do the blood check, especially among those female patients. Another 50 years old female. Here comes with the improvement. Another 48-year-old male along the occipital part. A 45-year-old female. We can see the hair start to become a bit thicker or more volume as visually. So by applying this Tixel in assisting the hair loss treatment, the patient's satisfaction was higher relatively to the evaluation by the clinician. Maybe because I think the patient herself or himself feels they can feel more of the improvement by the hair thickness or when they brush their hair and then when they wash their hair. So by visually, I see the improvement in the hair thickness and the volume. There is no noticeable side effects, including the post-procedural folliculitis, wound healing, or infections. The patient reported no pain during the procedure. So by utilizing this Tixel, we can have multiple treatment. And I need to add up, I think can be add up hair loss treatment as assisting modality, and also in multiple areas, adding hair, and a low pain and sterilized titanium tip, and small portable and radiation free. So in conclusion, this TMFI technology can be a good option in assisting hair loss treatment with no downtime, a relatively low risk of side effects and patient discomfort. Of course, further studies by using an objective grading scale and measurements, also including some of the histological studies that may be required to accurately analysis of the mechanism and the treatment effects, and then addressing the patient's expectation while maximizing the benefits of this novel technology will provide a superior aesthetic result. And thank you. This would be my presentation.
Thank you very much, Dr. Jonathan, for this wonderful educational webinar. If you have any questions, please write them down in the Q&A comments.
Here comes with a question. Do you get any hair burning at all? Okay, this is some tip I have to share. At first, why do I choose 400 micrometer with only 5 milliseconds? Actually, at first I use 10 milliseconds. And then just by close to the hair, I can smell a little bit of a burning smell already. So I do not, when I want to do the application of the Tixel, then I get close to the scalp. Other than that, I remove from, I keep it away from the scalp. Another thing is that by lowering down to only 5 milliseconds, I don't smell all those like burning of the hair. I don't see those fragile, turning the hair become fragile or burning of the hair after reducing to 5 milliseconds. And at first, I also apply this Tixel in the frontal part first.